For us today, kind of interesting. Just before I got on the webinar today, I saw a story saying the CDC is considering putting out a guidance reinstituting the mask mandate in certain parts of the country where vaccination levels are low because of the current surge that we're experiencing in some parts of the country, particularly among unvaccinated folks because of the Delta variant. So kind of stay tuned with that. But that kind of leads into what I wanted to talk about today, which is kind of revisiting the vaccine discussion. So where we are right now, according to the CDC, I think this statistic is a day or two old, but over 56% of the population aged 12 and up are fully vaccinated, according to the CDC. And of course, that's 12 and up are the only folks for whom the vaccine is currently available. I am seeing stories suggesting that sometime this fall, we will probably have approval for ages 5 to 12. Also for the vaccine, so kind of stay tuned on that. But I think given the surge that we're seeing among the unvaccinated, given that the current numbers that we have, which obviously is not quite as good as where we want it to be at this point, I think a lot of folks are asking, the government's asking, medical experts are asking, what can we do to get more people vaccinated? So there's an access issue, and I think governments are dealing with that issue. People who, even though there is vaccine available to them within 5 miles of their homes, and I think that's most of the American population, even so, there still are barriers to them getting vaccinated. And I think the public health system is trying to deal with that issue. But the other issue, of course, is the hesitancy issue. And how do we deal with that? Well, some employers are stepping in to fill the void, right? So you guys remember my carrot and stick discussion that we started having several months ago. A couple of interesting examples of that. So the NFL came out, if you're a football fan, I'm sure you saw this in the last week or so, saying a couple of different things. One, they're going to fine unvaccinated players almost $15,000 anytime they violate COVID-19 procedures for the season. They're not going to have the flexibility around rescheduling games this year. As you may remember, last year, there was lots of schedule shuffling. I think we even at one point had games on like a Tuesday night because of rescheduling due to COVID outbreaks. NFL is not going to be as flexible this time. If teams can do something in their bye week, great, but otherwise there's not going to be that kind of reshuffling going on. And then on top of that, if a team's forced to cancel a game due to COVID infections that come from non-vaccinated players, the team's probably going to have to forfeit the game. They're going to have to forfeit game checks. The other team may have to forfeit game checks. So that's a big stick that the NFL is wielding to try to get more and more players to be fully vaccinated. And I know that sports leagues, there definitely is some hesitancy. I know the Phillies have been held up as an example of a team that really is not getting vaccinated. So interesting to watch because obviously when we talk about professional sports teams, we're talking about unionized environment. So a lot of rules, there are contracts in place, something to kind of watch as we go forward. And then there's some examples of the government employers taking a more of a stick approach. Mayor de Blasio in New York City has said that the city will require city workers to either be vaccinated or get tested weekly for COVID-19. So if enough employees get sick of the weekly COVID tests, maybe that will motivate them to get vaccinated. We've also heard from the Department of Veterans Affairs. This is a federal agency, first federal agency to say that they're going to require over 100,000 of its frontline healthcare workers to be vaccinated, and they're giving folks 2 months to get the vaccine. And it appears that the stick there is that folks who don't get vaccinated will lose their jobs. And then California also announced that they're going to require state employees and some healthcare workers to show proof of vaccination, or again, similar to New York City, face that mandatory weekly testing. So this is kind of interesting against the backdrop of what's going on with the Delta variant, and we're seeing surges in some parts of the country, trying to find ways to motivate more and more people to get vaccinated. So this is very much a stay tuned kind of situation. At the same time, we are seeing the lawsuits continue. I just read a story of a situation in New Jersey where a healthcare organization mandated the vaccine, but apparently they didn't engage in an interactive process for an employee who claimed a religious exemption. And now there's a lawsuit around that. So do remember, if you're thinking about mandating the vaccine, or you're thinking about doing something that's similar to what one of these governments is doing, talk to an employment lawyer first. Just make sure you understand the ins and outs and the risks that are involved with that. And then kind of on another front with regard to COVID, you may have heard yesterday in the news, President Biden made a speech around this. 31st anniversary of the Americans with Disabilities Act was yesterday. Along with that, President Biden announced a guidance that will extend ADA protection to people with the long haul COVID type symptoms. There is a joint memo from the Department of Health and the Human Services and the Justice Department on the topic. Now, remember, that's just a guidance. Doesn't mean that courts have to listen to it. Courts have to follow it, but I think it's something important for employers to be thinking of. If you do have employees with any kind of long haul COVID symptoms, and what are we talking about when we talk about long haul? Continued issues around shortness of breath, breathing issues, the loss of taste and smell, all that usually is not going to be something you need to have to worry about accommodating, but those types of issues, the brain fog, the lethargy that we hear about for some people months after they've been diagnosed with COVID. If someone comes to you, if an employee comes to you and says, I have these long haul COVID symptoms, I need a reasonable accommodation, don't dismiss that out of hand. You're going to need to go through the same type of interactive process that you would go through for any other employee asking for a reasonable accommodation. And again, for our members, if this happens, call hotline, get in touch with Member Legal Services, and we're happy to help talk you through that, but something to be aware of. That's all I've got for this week.
I think, and I don't see any questions today. So again, the next twist is now that I like the carrot versus the stick. So, think through what your goals are. And I think Amy's point about talk with your employees, kind of see what people are thinking, and, have a dialogue, I think is super important right now. So have a good week, everyone. Again, thanks to Carlo for giving us some, tips that might be significant for some members. So, we will send the slides out, and as always, we look forward to seeing you next week. Take care.